Can you see by the dawn's early light what so proudly we hail at the twilight's last gleaming, whose broad stripes and bright stars through the perilous fight o'er the ramparts we watch were so gallantly streaming, and the rocket's red glare, the bomb bursting in air, gave proof through the night that our flag was still there. Oh, say does that star-spangled banner yet wave o'er the land of the free and the home of the brave?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Hello and welcome everyone to our 2022 VA Loma Linda Mental Health Summit. I'm Chaplain Richard Ross, the Mental Health Chaplain. I'd like to now invite you to bow your heads with me in a time of prayerful reflection. In our gathering together for today's summit, we first pause to recognize that even with the many positive efforts that have been made, including simplifying the phone number of the Veterans Crisis Line, our veteran suicide rate remains virtually unchanged. Therefore, as we unite with state and local government health care providers from the San Bernardino and Riverside areas and seeking to better support one another in addressing this national issue and community problem, may we acknowledge that we need God's help more than ever before. And therefore, as we prepare to embark on today's training summit, may we be mindful of not only PTSD and TBI and their impact on the recent spike in completed suicides, but also be open to consider the dimensional problem known as moral injury, and maybe also other factors less fully explored in better addressing the dilemma and lament of those veterans sitting on the fence of suicide and hopelessness. May your Spirit guide us in our working together, and may you, O God, also work through us as your people, as well as through the therapy, medication, and medical equipment, as extensions of your hands in this world, even though in some ways we ourselves may be broken. However, there is a scripture that reminds us that by his wounds or stripes we are healed. Therefore, as wounded healers, may you use us in healing others who are broken, both body, mind, and spirit. And may this begin with our sharing of your abundant love that fills us up and overflows from ourselves to others, that you might also fill them with a sense of renewed hope and transformative love that renews their minds. Amen. God bless you.
Quite convincing enough, I'd also then maybe gently challenge our listeners to consider how, practically speaking, how has this belief that nobody can help me unless they've been through it, how has that been working for you? how has that helped you, and how has that maybe hurt you or distanced you from the people that actually care about you and want to help you?
Hello, everybody. My name is Carmen Macias. I'm a licensed clinical social worker with the Loma Linda VA.
And good morning. My name is Raymond Espinoza, and I am vocational specialist with Loma Linda VA.
Hello, and thank you so much for joining us today. Today we will be doing a therapist panel, and we're excited to be joined by 3 mental health professionals. So I'm going to ask that each of our professionals please introduce themselves. So we're going to go ahead and start with Ms. Maritza. So go ahead.
Good day, everybody. My name is Maritza Grau Magad. I am a licensed clinical social worker, and I have been in this profession for 30+ years, and it's been a very interesting ride. I have held many jobs, and that I'm very proud of, especially being a former director of a psychiatric hospital in Puerto Rico. And right now, I work as a clinical social worker with the Suicide Prevention Program. I am one of the high-risk therapists and their team leader. And also, I have the immense honor of training the clinicians in mental health in cognitive processing therapy. I am a trainer and a consultant for that program. And last but not least, I am also the evidence-based psychotherapist coordinator for VA Loma Linda.
Hi, I'm Tiffany Kressel. I'm a licensed clinical social worker. I am in primary care mental health integration, or PCMHI, at the Marietta CBOC. I've been with the Loma Linda VA for about 7 years now. And before this position, I was working in our VA supported housing program with veterans struggling with homelessness. And prior to that, I was an intern while I was still earning my graduate degree in social work. So most of my career has been here with the VA so far.
Good morning, everyone. My name is Dr. Timothy Lee. I work as a psychiatrist for Loma Linda University Department of Psychiatry, and I have worked closely with our colleagues at the Loma Linda VA Veterans Hospital. I have been a psychiatrist for 12 years. I was the assistant director for our psychiatry training program for 3.25 years, and then took over as the full director from then until now. I also ran our hospital psychiatry consult service for Loma Linda University Medical Center for 12 years up until last summer. And currently I'm primarily in the outpatient setting in clinical practice, supervising psychiatry trainees, practicing psychotherapy, counseling. And so, yeah, glad to be here.
In previous years, we've had veterans that are participating in therapy share their experiences with the hope that it would help to break barriers for those that are considering therapy. This year, we'd like to give mental health providers the opportunity to share information that you guys would feel would be helpful for those that may be considering mental health services. And so let's go ahead and just jump right into it with the first question. And it's a bit of a cliche question, but I do feel that it's helpful to understand. And that is, what made you guys choose this profession?
In my case, I found back in the day that social work is a very varied and dynamic profession. Originally, I studied in psychology, but then because of different reasons, I chose to go for my master's in social work because it offers so many variants on how to serve people. And then eventually I fell in love with mental health, and this is why I have stayed. And again, social work gives me the opportunity not only to do psychotherapy with, in this case, with the veterans, but also dwell in other areas like economic resources and advocacy. And sometimes we all need to do a little bit of that, even when we are concentrated, in my case, in mental health.
Thank you. Anybody
Yeah.
else want to jump in? Go ahead.
Yeah, I picked social work kind of for a similar reason in that like there were a lot of it's versatile. So if you want to work in mental health or more advocacy or like there's a lot of different jobs that you can do and they all involve helping people. I wanted to get into the field of mental health personally for a couple of reasons. I have some mental health issues in my family. I had a cousin who I grew up with like a brother, and he completed suicide when I was an older teenager. And so that made me really want to kind of dive into this field. And my dad is a veteran, and his benefits even like paid for a lot of my schooling and stuff. And so I thought like working with veterans was kind of a cool way to give back and still be in working in mental health and helping people who really need it, who might be at like low points in their life.
For me, coming into third year of medical school, I really had no idea that I would end up doing psychiatry. And I realized when I did my clinical rotations in the psychiatric setting that I had a lot of subconscious biases and culturally laden misconceptions about what it's like to work with people who are struggling with depression, anxiety, other forms of mental health challenges. And so in my clinical work, I really got to kind of examine and disabuse or resolve those misconceptions and really appreciate the deep privilege of being allowed into a very private part of a person's life and to kind of journey with them through their experience and their pain. So I realized as I went through the rest of my clinical years that to me was the most meaningful part of working with patients, caring for people as a doctor, or at that point as a medical student, was really engaging on that level and understanding people as people, not just as a medical problem. So like I felt on other specialties that I was rotating through, we were so busy getting caught up in like examinations and lab tests and medications that like who they were as a person, kind of took a back seat, and they were just the person who had a liver problem or a heart problem. And that was what they were there for, and that was what the doctors were there for. And even if I was able to connect on a personal level with a patient, it didn't seem to matter to the doctors that I was working under, because that's not what they were there to deal with. So that really made psychiatry for me an obvious choice.
Well, thank you guys for sharing that. I think the one common point with all three of you is that there was a specific reason, like a specific calling that kind of led you into mental health services. I think it's safe to say nobody really gets into mental health for the money part of it. So can you guys go into kind of sharing your examples of, or your feelings on the relationship between therapy and mental health services and medications in mental health services?
I have to say that through my career, my experience has been that the combination of both psychotherapy and medication works really, really well. And I think it's more of a complete process. I used to work in the PTSD clinic in VA Puerto Rico. And back in the day, we didn't have much to treat, veterans with PTSD. And once evidence-based came into the panorama, not only the psychotherapy worked really well in combination with the medication, Later on, once the person had finished completing either prolonged exposure or cognitive processing therapy, the results were so amazing that our psychiatrists could start tapering down medications. And in some cases, people didn't need more medication. And if they did, it was in a very lower doses. So that's where I learned, that how successful both treatments can complement each other.
Yeah, I think it's an interesting balance, and definitely the two can be complementary or additive to one another. And with any individual, the hope is that an individual has access to both options. And we know that's not always the case, because of financial or geographical restrictions, or maybe personal preferences, or all sorts of factors can weigh into that. So we really need to start with where the person is and if they're open to either or both. That being said, I'd say, and it might be surprising to some people to hear a psychiatrist say this, but I'd say there are very few mental health conditions that can only be treated by medication, or for which medication is the primary part of the treatment or part of the healing process. I'd say the vast majority of conditions, even though medication can help, counseling and therapy is going to be a really crucial part of full and whole recovery for any person. And there certainly are, on the flip side, there are a lot of conditions where therapy itself can be very helpful and effective for those that choose not to take medication. On the other hand, for a lot of those cases, if a person chose to also take medication with a therapy, they could experience faster and potentially fuller recovery as well. It's interesting that I'd like people to understand that in our healthcare system, because of the shortage of providers and professionals in relation to the needs and the demand, that the healthcare system really does, I think, just from a practical perspective, try to partition clinicians into being either therapists who do counseling and talk therapy, and then the psychiatrists who are trained to do both medication as well as talk therapy can feel pressured by the system into just doing medication, because we have colleagues who are able and even better trained to do counseling or therapy. However, I think for a lot of psychiatrists, that's not what we went into medicine and into psychiatry to do, is just to throw pills at people. I think there really is a desire for a humanistic approach and a whole person-centered approach. And it's really the system that kind of forces us sometimes, due to time limitations and whatnot, into kind of being boxed into this role of focusing just on medication and letting someone else do the counseling or therapy.
Yeah, my role here in primary care mental health, a majority of my role is coordinating care. So I'm doing brief assessments or getting warm handoffs from primary care appointments for veterans who need to be connected to mental health services. And so I'm having a lot of these conversations with them, after I triage them and kind of talk with them about what options may be a good fit, or programs that the VA has may be a good fit. Like, of course, medication and therapy come up and people will have a lot of questions. And so I'll try to focus on that complementary sort of relationship between medicine and therapy. Some people are nervous, right, to start medication, or sometimes they're expecting it to be like a quick fix, right? There are a lot of maybe like misconceptions or like assumptions about what medication like can and can't do. And so I'm having to kind of navigate sort of explaining how it can be used and that every situation is very different, right? And that I kind of will try to kind of explain to the veterans as the medication might kind of help almost like take the edge off in a way so that you can work on the underlying stuff in therapy, right? Because even if some of your symptoms might improve from medication, there's the underlying cause of it, right? There's the underlying issues or concerns that need to be addressed, or else you're just kind of, putting like a Band-Aid on it. And that some people may wean off it over time. Some people may need a lower dose over time. It's very, very different for everyone. So I try to kind of ease some of those fears in that way, or kind of explain how like both services used together might be ideal. But yeah, our system is kind of hard because with time constraints and sort of how appointments are set up. And I know at least over here, our psychiatry appointments are, 30 minutes and like back to back, right? And so everyone is kind of pigeonholed a little bit into like, okay, the psychiatrist does medicine and the psychologist and the social workers do therapy, and there's groups, right? And so it's kind of, I hear what you're saying, Dr. Lee, that like sometimes the system isn't set up perfectly, but we kind of piecemeal things together in a way that they're still getting that same service, right, of the therapy and the medication, hopefully not just one or the other if they don't need just one or the other. We make it work.
And how common do you think it is that that a client would need both? Based off of you guys' experiences, can you kind of share on the differences that you've seen with veterans or with clients that have been real stuck on only doing one, either thinking, that the medication will fix everything and not really worrying about trying any sort of therapy, or vice versa, doing the therapy but being unwilling to try medication? Can you kind of share some examples or some thoughts on the importance of being open to trying both at the same time?
I have to say that we have to go case by case. I don't think there is a one size fits all when it comes to treatment. I would love to say that, yeah, you come to therapy, that's going to take care of everything. I like to play it safe and offer alternatives, realistic alternatives and options for the veteran in this case. And in that sense, I am empowering the person with their treatment. And again, not discarding other possibilities as well. I wouldn't feel comfortable just offering only one alternative. And in that, I will delegate that, to the psychiatrist. I mean, I have to be respectful of their knowledge and their experience as well. I might not have all the answers, so I always like to keep that open. Yeah.
I try to like empower them too, in that like if they're not sure, maybe meeting with a psychiatrist in addition to therapy, and that kind of empowering them in that you're allowed to kind of change your mind or say no or gather more information, right? But it would be best to talk to the doctor, right? The professional who would know all the ins and outs about psychiatric medication and what it all entails. At least you can make a more educated decision, right? So I'll kind of try to sell it on that sometimes. If I've noticed somebody maybe has more severe symptoms or might need that extra support from medication as they go through therapy. But it is totally, I think it is totally case by case, right? And some veterans maybe can get better just through therapy. Some need both. Some need groups, right? There's just different, it just totally depends on the person and what they're presenting with. We even have in primary care mental health, we do brief therapy. So when there are those cases that, maybe don't need as intensive of treatment or as long term of treatment, the VA has that option as well. So we'll do 6 to 7 sessions, 30 minutes long, to address more like mild to moderate symptoms of depression or grief and loss, or more mild symptoms of PTSD or, those things. So we'll try to kind of meet the veteran where they're at, right? And if it's something that maybe can be addressed with just therapy, then we have that. If they need, psychiatry, then we have that. We try to kind of guide them and give them as much information as possible, but I always try to sell them on like, it can't hurt, right? To meet with another professional and get another opinion or answer your questions. Because I think there is a lot of fear like surrounding medication.
Yeah, to throw some ballpark numbers out there, that's not based on research studies or articles or anything, but I'd say conservatively speaking, probably less than 10% of mental health conditions truly really only need medication as like the primary thrust of the treatment. And on the other end, I'd say ballpark maybe like 15% of conditions are things that really need just therapy, and medication has very little role or benefit to play. So that leaves another like 75% that ideally or optimally would benefit from doing both. That can benefit from one or the other, but to get the full benefit, probably doing both, again, would create either faster recovery or a greater amounts of healing and recovery. And just to throw some examples out there, so for people that situations where somebody really primarily needs medication would be if they have a condition like schizophrenia or a bipolar disorder where they are like acutely confused or out of touch with reality. Those are cases where therapy is not going to have much of a role until the medication has gotten the person back to closer to their normal self. On the other end of the spectrum, conditions like personality disorders, like maybe borderline personality or narcissistic personality, or certain kind of situational conditions like bereavement or grief, for example. But the person really needs this therapy. Medication is really not going to add much in that situation. So those are just some examples, broadly speaking.
And you guys you already touched on this a little bit, but just to expand on it, can you guys share what you've been able to do to strengthen the patient-therapist alliance in the past? I mean, I know when somebody is seeing a mental health provider, there's definitely that sense of vulnerability, and for some people that can be a little bit scary. What have you guys been able to do in the past to kind of help strengthen that alliance?
I tend to use what I call respectful informality. That means is that I know that the client to call me by my first name. I avoid using a lot of clinical jargon. I come up with my own scripts and try to adapt to the background and culture and what I know about the client. And I also do my homework trying to understand where that client is coming from. It's my profession, right? I try to keep an open ear and honor and start where the client is, even if that means adding additional time or sessions to the treatment that I am hoping to provide. And pretty much with most people, I have to say, I use a lot of sense of humor, and I use very ridiculous analogies and symbols, and I try not to be too high up there, because I noticed that, yes, people need treatment, but they also need lots of empathy, lots of kindness. And believe me, you can never go wrong with kindness and giving people time. That's pretty much how I go about it.
Yeah, totally
you.
like meeting them where they're at, right? And
Yeah.
yeah, if you can you start to learn from them, right? And what they respond best to. I try to make it feel as less judgy as possible, right? I try to make them feel like that there's nothing that they can say that would make me think any certain way of them, or that sometimes we'll talk about, they can share, of course, what they feel comfortable sharing, but kind of know that like we've heard it all, right? So there's nothing that has to be off limits. There's nothing that's gonna make us think any less of them or anything, right? We want to help them, like always trying to come from like a perspective of like I'm just wanting, I want to help you. I want to support you. Like you are the captain of this ship, right? And I'm just here helping kind of guide or helping give some direction, but you're the professional in your own life, even though it seems like I'm the mental health professional, right? Like you, you're kind of in control of a lot of things here, and just kind of meeting them where they are and letting them know that it doesn't have to be so clinical, like you were saying, that kind of being a little informal and being more like a human being when you're meeting with them, I think goes a long way. Yeah.
Yeah, just because you're on the other side
Yeah.
of the desk doesn't mean that
Yeah.
We get it all together.
Yeah.
I can say that about myself.
Yeah. Totally.
We are all human, and we all have our struggles and difficulties, good days, bad days. I had, after last summer, after 11 years of work, I just got totally burnt out on the job and had to take time away and get my own therapy and take an antidepressant medication and kind of rebalance my life, kind of change my clinical duties to make it something more sustainable long term. And to come back to what we were talking about a little earlier, I think it really kind of hits on the importance of person-centered care and really meeting the person where they're at. At Loma Linda, we do have an emphasis on holistic care, and all the components that we've been describing kind of play into that. And we, as an institution, and I, as a clinician in particular, and an individual, have also an interest in not ignoring person's spiritual beliefs if they have any. I'd like for our audience to understand that there is kind of a sordid or ugly history between spirituality or religion and mental health as professions. And this kind of goes back to, the earliest days of psychiatry and mental health care, where Sigmund Freud thought that people who have spiritual religious beliefs, they're just using it as a crutch because they can't face the truth of reality and the world as it is. And so that just set right there this barrier, dividing wall between communities of mental health and of faith and spirituality and religion. We've come a long way since then. I think there's very few clinicians that would still hold to Freud's view of people who have spiritual religious beliefs. And yet, I think because of that tradition that we're steeped in, a lot of clinicians aren't really trained in talking to their patients about their spiritual beliefs, or being open to listening to them talk about their spiritual beliefs if they have any. And so for me as a clinician, it's not that I'm there to tell the patient about my beliefs. I'm there to understand the person's beliefs spiritually, religiously, whether they're Hindu, Muslim, atheist, Christian, Jewish, whatever it might be, and to understand what part that plays in their life, both to the good and to the bad, and kind of weigh that into the person's understanding of themselves and also into their treatment and their care, especially the counseling and the psychotherapy.
So I'd like to ask a question. What would you say to a client that feels that you can't help them because you've never been through what they've been through? I know we hear this a lot with veterans, and so just curious, in your experience, how do you handle that?
Oh, I always start by honoring that. That is so true. And I am scared even to touch a military base, leave alone become a military person, right? So yes, I honor and I respect those differences. I understand that I will never experience what they have been through. However, I will reassure them that my life experiences and my education have really prepared me to work with them. And that, and I will make analogies like just because an oncologist is an oncologist doesn't mean, they don't have cancer, so they cannot treat cancer, right? And so I will give them the time to get to know me and see where this is coming from. And I give them plenty of information about the treatments they are about to start. I try to reassure them with their concerns. And then, like Tiffany said, this is not a place where we are going to be judging each other. This is a safe space. This is for you to heal. And I'll propose a challenge to you. When you think I'm not understanding something that you're trying to communicate, how about I give you the space and you teach me and you show me and you communicate with me. And that tends to work quite well with people. Again, this is not something that, thank goodness, we don't have to go through everything through that the human experience entails to be able to be efficient and help in the recovery process.
Yeah, I try to do that too, like help me understand, right? Or kind of putting it back to them, and that like I want to learn from you and I want to understand you, right? I don't have all the answers, but let's figure out what is going to work for you, because not everything is so textbook. And I'll try to tap into that human. Everybody's life is complicated, right? We've all gone through things. And we can relate to the emotions that might be similar, right? So even though we don't have the same shared exact experiences, I might understand feelings of grief, loss, trauma, anxiety, panic attacks, depression, whatever it might be, right? There might be similar feelings or emotions or how we've reacted to things that, like, even though maybe the stuff I went through is different than what you did, a lot of those feelings are similar, right? And as a human to human, we can understand each other in that way and trying to kind of like tap into some of that.
We have more in common than different.
Yeah.
Yeah, I think it's really important to make a distinction between ability to understand and relate to someone and the ability to help someone or care for someone. And I think that's where that kind of reaction or that idea kind of generally comes from, is if you haven't experienced what I've been through, if you don't understand it, then you can't help me. And I think that's a dangerous belief to buy into. Take it out of the medical field. I think a lot of our listeners, are fathers, our husbands, or and it would be to me like saying, well, since you're not a woman, for those in our audience that are male, since you're not a woman, you can't possibly understand or help or care for your wife or your daughter. You know, it's
Good one.
that would be, I think anyone would object to that idea. I think any man or woman has enough humility is going to acknowledge that they can't completely understand the opposite gender. But I think to take it to the extreme and say that just because you don't understand someone you care about means that you have no rights or no ability to help them is a really dangerous, I'd call it a lie that people buy into, but that could be a pretty strong term. But if what we said in that regard's not really quite convincing enough, I'd also then maybe gently challenge our listeners to consider how, practically speaking, how has this belief that nobody can help me unless they've been through it, how has that been working for you? How has that helped you? And how has that maybe hurt you or distanced you from the people that actually care about you and want to help you? And, you know, if just keeping to yourself and dealing with everything on your own, if that's been working, then maybe you don't need help and you probably wouldn't be listening to this right now. But if you've been doing things that way for a while, as I suspect many of us have, and you're suffering and you're in pain, maybe it would be worth trying to go the other way and test the possibility that other people can help you, even if they don't understand fully what you've gone through.
Totally. And the cool thing with the VA is that well, a lot of our mental health professionals are veterans themselves. You know, even if no one on this or us three on this panel are not. But what's cool is that we can kind of usually work with our team, since we have all different disciplines, all different backgrounds, and maybe kind of supplementing some of that, right? Of like, you know, if they're still not feeling completely comfortable, kind of still working with them, and then maybe connecting them with a peer support specialist to talk with about, you know, that shared veteran experience, and, you know, maybe still then getting, or not getting them, but them feeling more comfortable staying on board with the therapy or meeting with you for medications, even though you're not a veteran, right? We can kind of ease into that, like addressing that discomfort. Or, you know, maybe someone on your team, maybe your therapist is not a veteran, but your psychiatrist is, right? And kind of playing into that and reminding them that we all work together as a team and we're here to understand and trying to meet you where you are and helping you. I think that's kind of a cool bonus in working with the VA and veterans getting their care here, is that there are some options, right? If we really, really can't immediately kind of jump over that barrier, we can kind of chip away at it with some of these other options.
I jokingly say to them too, hey, you can give this a try. And if you don't like me, you can always fire me. I mean, find another alternative for you.
Mhm.
And most people laugh at that and they begin to feel comfortable. Because they see, you know, we as a team, the VA, we all mean very well, and we are very committed to helping them. So yeah, that tends to work too. I say that.
That's a really good input there. That was a good question, Carmen. I think that, you know, within the VA, we hear that quite a bit. So I'm glad that was addressed. And I think this next question, I know I've heard quite a bit as well. And so a lot of times, especially when I worked as a peer support, I would meet with veterans and they would have gone to maybe 1, 2 mental health sessions, and they say that they feel worse than before it started. Can you guys talk a little bit about that, about the mindset that things will get worse before they get better?
I love that one because normally what I do is treat PTSD. And people have this notion that, oh, if I talk about this, it's going to get worse. But I do not believe that, and I have not seen that. I always tell them, well, things are already bad. And in the case of PTSD, it's not like you hit a pause button in your symptoms and they wait for you to resolve whatever is happening in your life to then hit back that pause button and go back to, the psychopathology of it. So I always reassure them that that's not true, that it might feel like they are getting worse because they're finally working with the problem, because they're addressing their symptoms. And this is the first step or steps to deal with this problem. And just because you're starting to work with it, you're being empowered. PTSD is no longer driving you. You are doing something to control and recover and take charge of your life. And I tell them, look, just give me a few sessions and you will see that when we work together, you are going to see how that is a myth, that is not true, that you will do much better. And again, I'll tell them, if not, you can fire me. Lucky for me, that hasn't happened.
I would liken it to having a wound that like scarred up, but there's like still underlying like infection or underlying problem under that scar. And yeah, it's human nature to, if something's painful or uncomfortable, you want to avoid it if you can't immediately fix it. So it's natural to want to just push stuff away, to not deal with it, and buy into that old adage that time heals all wounds. But we know that may be the case sometimes, but definitely not all the time. There are wounds that if you don't take care of them and they scar over, that infection underneath, that pain is still going to be there. And while it might on the surface seem like you can't directly see it, once you actually open up that scar to see what's underneath, you realize that there's still a lot of pain, a lot of damage, this infection, so to speak, underneath. And so to really fully heal that wound, it is going to be painful initially. And then as you do the hard work and you receive the treatment and the care, things will more fully heal and get better over the time, as opposed to if you just left that wound unexamined.
Yeah, I'll try to have similar conversations with them and kind of explaining it or setting realistic expectations, right? That yes, of course, talking about past trauma or working through the things you've been avoiding it's going to be uncomfortable, right? It's not going to feel great at first. And look at how it's seeping into all these other parts of your life, right? Even though you think you're avoiding it, are you really? Just because maybe you're not directly thinking about it always or talking about it always, look at all these symptoms that brought you here, right? Or look at how it's impacting your life, your relationships, your sleep, whatever it might be, So you know, even though there might be some discomfort in addressing the issue head on at first, is that any worse than you continuing your whole life dealing with what you're dealing with now? It's almost like surgery, you know, for something, right? The surgery itself, yeah, that's nobody wants to do that, right? Nobody wants to go and get surgery and be in a hospital and have to heal. But the long-term benefits of having an issue resolved and feeling better, you know, are worth that initial phase of discomfort. And that I tell them too that a part of therapy or a part of treatment is also giving you some skills to use initially, you know, while things might feel a little more uncomfortable. You know, you and your therapist, you and your psychiatrist, you and your group facilitator, your peer support specialist, a lot of our conversations are about, okay, so what are some like tangible things you can do to just feel better in the moment when you need to, right? Sometimes we'll call it like behavior activation, right? Clinically, or self-care, but really working with them on like, while you feel uncomfortable, let's focus on some tools right now that can help get you through. We're not just going to leave you hanging, right? Oh, now you feel so bad. Bye. See you next week, you know?
I will be very direct too. I will tell them, yeah, things are going to get worse before they get better if you don't do anything about it.
Yeah.
Because other areas in your life are going to be impacted. And then we're not going to only deal with your mental health condition, but also other things in your life that are probably a direct result of your condition. So yeah, things are gonna get worse if we don't do anything about it. So this is a good time to start contemplating treatment.
So our next question is, in your opinion, is complete recovery from mental health achievable, or is it a lifelong process?
I would say that recovery is possible, definitely. And thank goodness we have good instruments to help the person in that journey. As the coordinator of evidence-based psychotherapist, what can I say? These are treatments that have been tested, used, studied throughout the years, thousands of times. And we can attest that these treatments work. We can offer realistic hope. We can offer recovery, but of course, I am always very clear with the client. I would always tell them, look, this works, but it works if you do your part. This is how it works. As good as a therapist that I could be, I cannot produce miracles. You have to help with that miracle. And once I make that very clear to them and we're on par, we're ready to start. And it's a great, great source of satisfaction as a clinician to see how people truly make important changes in their lives. They do recover.
So the caveat I'd throw in there is we have to be clear on what we understand, and I appreciate the mention of expectations. You know, we have to be clear what we understand as far as what the person means by recovery, right? If we mean, can I get better? Can I not be in this pain anymore? Absolutely, yes. If the question is, can I go through this treatment and then just be normal and not have to think about this ever again in my life? The question is, the answer is maybe. I'd say there are, some situations where, yeah, you can undergo treatment and resolve something and then put it behind you. But I'd say that's the minority of situations. In the majority of situations, it is going to be, even when you make a full recovery, you have to engage in a lifelong journey to maintain or reinforce those things you've learned and those changes you've made in order to keep that suffering or those problems at bay.
Yeah, I have similar conversations with the veterans I work with, and that like it's a maybe. We never know what curveballs life is going to throw at us. things can happen that might, you might have been in recovery or have maintained, significant improvement for a really long time, and you've found a system that works and you've graduated from therapy or whatever it might be, and then life hands you something totally unexpected and some of those symptoms might creep back up again, right? Or some of that old stuff may come up again, and you might need to fine tune your skills or change some skills because you were never expecting to go through something like this, or you didn't think you would react to something like this, like how you're reacting now. And, sometimes people then will jump back into therapy, even if it's brief, or they might resume medication that had worked for them in the past, right, to get them through. It's just a case by case thing. But yeah, I think it's just, it's setting those realistic expectations of, yes, you could be significantly better or feel totally better. It might be permanent. It might be, back and forth. It might be, you might take a little step back. You might take a big step back someday. But now at least you know what to expect, right? When it comes to treatment, you know what had worked for you before, you know what you can achieve and where you can get, and you can get there again. You might just need a little help again. Some people never need a little help again.
But they will be in a better position.
Yeah.
They will definitely be in a better situation to handle whatever conflict or situations life throws back at them. Because normally evidence-based will provide with skills, the skills of a therapist, and for them to effectively deal with situations. That's not to say that you couldn't come back to mental health services,
Yeah.
but you'll be in a better position to deal with whatever life throws at you, definitely.
All right. Well, thank you guys for that. And we had one more question that we'd like to ask, and we're looking forward to getting the responses here. Can you guys just share some notable experiences that you've had as a mental health provider?
Well, I always say to my students, when I provide cognitive processing therapy, when I provide them with the training, I always say that if I had lasted this long in this path, it's because of the satisfaction of the results that I receive. And that is to say that it has been so rewarding for me to have met people in different scenarios years later after treatment, coming to me and expressing their gratitude because of how well they're doing, how their lives have changed. I had been in surfing tournaments and concerts and malls and places that normally people that have been affected with certain mental health conditions cannot participate in. And then suddenly I get a tap on my shoulder and hear someone telling me, I'm so happy with my life, or look, this is my wife, this is my husband, and look at me, I'm here and I'm having a great time. And I will be like, oh, great, wonderful. They even break confidentiality, and right there they start sharing. And, that's how big their enthusiasm is. So to me, that has been very rewarding. And again, seeing that something works and works well helps me not burn out and continue working with my clients and being at the VA.
Yeah.
Tying back to something that you mentioned earlier about we're all human, clinicians, professionals are also human. And so with any job, there's parts of it that are wonderful and there's parts of it that are like necessary evils or like the worst parts of the job. I think I can't off the top of my head think of a job where it's just all good, and there's nothing that you have to do that you'd rather not do or would like to avoid if you can. Like, I'm a pretty big baseball, basketball fan, an athlete. Yeah, it's amazing that they get to play a sport as their profession and that's their career, that's their job, right? But it's not just playing the game. Like every day, that's all their job is. There's the training, there's the hard work. There's recovering from injuries. You know, there's all these things. And so I say that just as a prelude to wanting to share my perspective on, you know, what for me at least are kind of the toughest parts of the job and the parts where I feel like I don't feel great about myself as a person or about my job, and yet I know I'm doing what is necessary. So specifically, like two situations come to mind. One is when I've been in a situation of having to keep someone in the hospital against their will in order to keep them safe or keep others around them safe, or to make sure that they get the amount of recovery that they need in order to change their trajectory to go on a better path. Of course, there's going to be times where people don't understand that, or because we are disagreeing about whether they need to stay longer, they're going to be upset. I understand that. And yet, I'd like for anyone, you know, God forbid that any of you should end up in that situation, but if you ever do, just to keep in mind that the doctor is not keeping you against your will because they have it out for you, or they're just like angry with their life and they're taking it out on you, or they just don't understand, you know, why you want to leave. They really are doing what they've been trained to understand is in the long term in your best interest. And it may feel like we don't care. It may feel like the doctor doesn't care about you. But I'd say that a doctor that really doesn't care is just going to let you do whatever you want. They'll just get you out of the hospital so you can go back to doing whatever you've been doing that's landed you in trouble, or continue to perpetuate your pain and your suffering, rather than do the hard work of caring enough about you to actually disagree with you and struggle with you over what's best. In a less extreme example that might be more relatable, when I have to disagree with a person about the medication that they want. You know, there are certain medications that are addictive that absolutely help in the short term, but also carry a lot of risks, either certainly in the long term as far as addiction, but even sometimes in the short term as far as causing dangerous side effects or dangerous interactions with other medicines the person's on. And so that is another kind of the worst part of the job as a psychiatrist sometimes, is having to say no to something somebody really wants because they know and we know that it's going to help them in the short term. But we say no because we know it's actually going to hurt them in the long run, or overall is not what's best for them. I remember one time when I was in training, I did get the chance to work at the Loma Linda VA, and I was meeting with a gentleman who had an issue with alcohol and also had an issue with anxiety, and he really wanted benzodiazepine to deal with his anxiety. And for some of the reasons that I alluded to, that would not be a good idea. And so I had to stand firm and tried my best to explain why I did not feel that would be a good idea. And he abruptly got up and stormed out of the office. My chair was closer to the door, so I distinctly remember a flash moment of, is he going to like hit me or something? Because he was really upset. You know, fortunately for me, he just walked out and left the clinic. You know, but even for at least the next day or two, I remember walking out into the parking lot at the end of the workday and thinking, man, is this guy angry enough they're gonna like wait in the parking lot and like get me as I'm like walking to my car? Again, I think that just highlights one that, you know, we are human. We have difficult jobs, just like many jobs have their difficult parts. And again, it would be a lot easier if I didn't care about what's best for a person to just give them whatever they want, even if it's going to potentially harm them, either in the short term or in the long term, rather than do that struggle with them or have that discussion or heated argument with them over why this is not a good idea and why I'm not going to do or give them what they really, really want, even though I understand why they want it.
You know, one thing that is instilled in you in the military is taking the hard right over the easy wrong. And I feel like that whole thing really just emphasizes that same thing, you know. So thank you for sharing that. Tiffany, go ahead.
Yeah. No, that makes a lot of sense. And there are a lot of challenges in working in the field of mental health, working with veterans. So those notable experiences, I think, are just the ones where you know what you did made a difference, you know, or those challenging cases, the cases, you know, where the veteran storms out of your office and you wonder if you'll ever see them again. Sometimes those cases come back and they engage in treatment, and that's one of our notable experiences, you know, it works. And those cases, I think, or those situations keep us all here doing what we're doing, you know, for all the hardship, just knowing that like every day you come home from work and your work day wasn't just a paycheck, it was helping people in their life. Even if some people maybe aren't ready to accept the help, you know that you helped someone that day, right? Or you helped someone that week. Or when you do run into them later on and they want to say hi, or they want to tell you how well they're doing because they feel like you had a part in that. That's what feels really good. And I sometimes wish like our veterans would know too how much they teach us personally, like what we take home. You know, sometimes I have a session with a veteran and it resonates with what I'm going through personally, and it helps me in a way sort of realize like what changes I need to make, or to practice gratitude more that day, or you know, or to resume maybe some skill that I kind of left behind before, or just having new perspective, right? If I'm working with someone of a different cultural background, or, you know, a veteran and I'm not a veteran, or whatever it might be, you know, just like being grateful for having like that learned, that experience, and how much that impacts our day-to-day lives, like our personal lives, even than just our professional lives. That's a really notable part of our job, I think.
Thank you. So that'll conclude the panel today. We want to just thank you again for your honesty, for, you know, everything that you've shared. We really appreciate your time.
Thank you.
Thank you for having us.
That's what Patriots do. That's what we're all about. Wins on and off the ice. I'm Bradley White. I'm 36 years old, United States Army. I worked under Special Operations Command. I've been with Patriots Hockey since August of 2020. Hi, I am Zachary Daniel. I'm 28 years old. I served in the United States Marine Corps 2013 to 2019. My MOS was 0313 LAV crewman with 4th LAR. I've been with the Patriots since February of 2014.
Hi, I am April Soaps. I was in the United States Marine Corps. I was an armor. I was in from 1998 to 2002. And the reason I got out was because I met this gent to my side.
Oh, I'm Justin Soaps. I'm 45 years old. I was in the United States Marine Corps, and I was an MP and machine gunner.
How's it going? My name is Brent Bowles. I'm 28 years old. I'm a veteran with the United States Air Force. I was security forces, also known as military police. I've been with the Patriots for coming on 5 months now.
My name's Matt Carr. I'm 57 years old. I'm an Army vet, and I was a scout, Iraq 2005. I've been with Patriots Hockey now for about 3 years, and I'm the San Diego area hockey operations manager.
How's it going? My name is Miles Sylvester. I am 32 years old. I served almost 10 years in the United States Army, and I was a 11 Bravo infantry. I spent my whole life playing hockey. I was supposed to go to college, decided not to go. Ended up pursuing a career in the service. Unfortunately, that was cut short. So in 2018, I was basically left with a decision to come back here. So I moved back from Fort Lewis, Washington, back to here. I spent one pickup here in Riverside, Icetown. That's when I first met Zach and Chris. And they basically showed me what the Patriots were.
What this program means to me my entire life. When I came back into Patriots hockey, I was at a very low point, a lot of personal issues in my life. They welcomed me back, after my troubles, and it literally saved my life. I was on a dark path and was having some really, really negative thoughts.
What I get out of the Patriots is it's become my second family. I love all the guys to death and girls. I mean, I'd go to bat for any of them. It's really turned into. It's really evolved from an idea over the years to an idea of just having a bunch of veterans in active duty playing hockey together to turning into a program that really helps veterans through their physical and mental health.
So, Patriots hockey, what does it mean to me? Patriots hockey provides an environment that, after coming back from Iraq, I missed. I missed being around the teamwork, the camaraderie. I missed my friends, my compatriots, and I found myself lost.
Being with the Patriots, like I said, definitely has given me a sense of family, brotherhood, and community that I missed when I got out of the military. When I first joined, the first day I walked into the locker room, it was as if I was seeing long lost friends.
But we enjoyed it a lot. As a matter of fact, our kids do it with us. So it's a family affair, for sure.
And some of the things that have really stood out to me with Patriots hockey is there's always somebody that's got your back. There's always somebody checking in on you. There's always somebody making sure you're okay. Networking together and helping each other out, which is one of the biggest things that a lot of vets, in my personal experience, didn't have. When we got out, we kind of felt alone. We didn't have our brothers and sisters next to us anymore. And Patriots has kind of brought us in like family. They've allowed us to come together, and obviously as a husband and wife playing together, it has become not only our family, but it's just encircled a greater family for us. And I think that's the biggest thing I see all the time, everybody networking, helping out, whether that's with resources for mental health, whether that's for jobs, whether that's for anything off the ice as far as community. Patriots hockey has got me personally out into the community again with a lot of our volunteer opportunities, things we do back in the community, and kind of broken me out of my shell of just kind of that isolationist.
So Patriots hockey saved my life. Now I have a great role in the program. It is something that is a blessing. It really is. And for my physical exercise, for my mental health, we have our mental release, and for the camaraderie. We're all a family. It's not just on the ice, it's in the locker room. It's every day. We're always communicating with each other. We have events outside of hockey. We really are a big family, and that connection to community that so many veterans look for and just can't seem to find, that's us. That's what we do, and everything that Patriots Hockey does is for our veterans.
It's given the guys a 2 or 3 hour break from reality. It's giving them that 2 or 3 hours where they don't have to worry about work. They don't have to worry about the bills. They don't have to worry about, for the active duty guys, they don't have to worry about their chain of command, getting on them for whatever, or, a bad field day.
And really, the real thing we're talking about here is Patriots Hockey today. And one of the biggest things that I've found in Patriots Hockey that I was lacking since I got out of the Marine Corps was that brotherhood and camaraderie. We started playing hockey for a couple years before we got into Patriots Hockey. We've been playing for Patriots for about a year and a half now, and it has changed everything. I suffer from PTSD, stress and anxiety disorders, and I found it hard to find a constructive outlet to deal with those issues. And like most vets, that turned to substance abuse and different problems, which just exacerbated the mental health issues that I was experiencing. Coming over to Patriots Hockey has really changed my outlook on a lot of things. It's really helped me, as well as our fellow players and fellow vets, to really come together in a brotherhood in a non-judgmental way where we can use resources together, not only on the ice, but off the ices to help each other out. I think that's one of the biggest things. I've been able to manage my stress and anxiety in a constructive way that's not only has the health benefits, but brings me back to that time when we were our brothers and sisters and we were looking out and having each other's six. So this experience really is just adding and exemplifying the things that we do in the military, but just taking that to on and off the ice.
What does it do for me? Everything. It does everything for me. It's brought me back to the camaraderie, something I was definitely lacking all around. It brought us closer. It brought us to the VA. I heard some nightmare stories through just media or whoever it was about how hard it was to go to the VA and they don't help you with anything. I'm here to tell you, absolutely not. I walked in there. I've had nothing but people help me from the very start to even today. So it's been quite an awesome journey for me personally. Something I would never turn around or give up ever. And I know my husband feels very much the same way. And I was able to get him to go in there as well. And it's done some wonders for us.
So after I separated from the Army, I was already an alcoholic at this point. Didn't know how to get help, didn't know who to ask. I had heard nothing but horror stories about the VA. And, I'm very, very regretful that I believed that. It was veritably wrong.
How has Patriots helped me through the low points of my life? Well, I'll be straight up honest. It's helped me not kill myself twice. Once in 2017? No, the end of 2016 through a really bad breakup, and then again in like 2017.
And my role in the program is working with suicide clinics, with addiction clinics, and with mental health clinics as well, to bring more veterans. Now, in my own experience going through addiction clinic and mental health clinic is just seeing so many of my brother and sister veterans just trying to find that connection to community. It's just so difficult. They think they can't relate. They think that people won't understand them, and that's why we're here. We really do understand one another.
It honestly, like everything I've said before, it's been my escape through everything, and we're all seeing that together. Like it's everybody's escape, but that's how this program has helped me, and it's helped me meet guys from all over the world that play hockey and network with other people and other teams from all over the country and the world. And, running into guys like Miles and Bradley, where, they've helped me with my VA stuff. They've helped me move. They've helped me, do stuff around the house, when I needed extra hands.
My alcoholism led to me ruining a relationship with my son's mom. after I lost that relationship, I went down a further spiral. I found myself in addiction for about a year and a half. That was just long enough for me to lose everything. I lost my house, I lost my car, I lost my family. Pretty much in the streets, just looking for that next high, in my addiction. That's what it had elevated to, from alcoholism to addiction. And I mean, I never once thought in my life that I'd find myself there. And so I started developing my relationship with my son again. All these things started coming back into my life with my sobriety and my recovery. And again, I'm at 4.5 years now, successful. I have things in my life I never thought I'd have, in my addiction and my alcoholism especially. Now I've got a very good job, very successful.
With the Patriots, it's that connection that you have when you serve in your platoons. It's that connection that you have when you get treatment from the VA, at least for some people, Like right now, I'm in a group chat with 5 or 6 teams across SoCal, and I could text them that my car broke down, and I'm going to have 80 people call me and be like, we're going to come take care of you right here and right now. That's what the Patriots hockey is to me.
Patriots hockey, we have community outreach events. We're out there mingling with the public. We're out there communicating with other veterans, trying to draw people to our program so that way we can help maybe save a life, stop a suicide, help somebody in their recovery, or just even transition back to civilian life. Maybe help them be able to find that connection, find that something new in their life to look forward to. We have our adult weekly games, sometimes bi-weekly or twice a week. And sometimes I find myself like, I can't wait to get on the ice with my family again. So what Patriots hockey does, I know, is for everyone. And my job with Patriots hockey is to bring more veterans to our program, to our family, and bring them on the ice, again, for their physical exercise, for their mental health, and for the camaraderie.
What the Patriots mean to me, basically, is a lot. Patriots have given me a family, given me a sense of community, sense of belonging. When I got out of the United States Air Force, I went through many years of being lost, and I fell into alcoholism and addiction. I was able to pull myself out.
It's spreading that culture. It's bringing in those veterans. And the longer I spend time here, the longer we keep expanding, the more relationships I keep building. And now bringing in these individuals that have served for 20 plus years, that now this is all they knew was being in the service. It's cut short. It's over. It's done. That chapter of their life is over.
But the ability to play with Patriots hockey and be on the ice and escape myself for an hour, to get that break, to get the energy out of my body, to get that workout, to be on the ice with my friends, that's where the healing happens. So that's what Patriots provides. Patriots provides that hockey environment so that the younger amongst us and the older amongst us, we can reconnect with active duty members. We can tell stories and give anecdotal help to the younger guys as they develop as leaders. We can help each other all the way around. There's so much healing that occurs in the locker room and on the ice. That's what Patriots do. That's what we're all about. Wins on and off the ice.
And it's actually amazing what we've been able.
You make me look fancy.
Just, thanks to the Patriots and thanks to the VA for being there for me and being the support. Oh yeah.
Whoa, hang on. Am I not allowed to swear? Probably. All right, no. All right, no. Time out. Cut. All right, cut. All right, thank you. I was like, that just slipped for a second. All right, rewind. Action.
Well, writing is a therapeutic thing. You first have to believe in writing, and then you have to believe that you can do it.
I heard of a place where warriors go to meet. Even during shutdowns, they eat and greet. Masks are everywhere and there's doom and gloom, but these warriors are brave, meeting in the back room. They arrive by choice to look each other in the eye, not worried about what people think. How could you, they cried. We're here to lift each other through the despair, a kinship amongst warriors who truly care. So if you're tired of therapists who only meet by Zoom, you're welcome to join us, the warriors in the back room.
So this group got started about 7-8 months ago. My son was about to deploy. He's on active duty, so I'm a Blue Star parent. I flew down to Texas. He was finishing up some pre-deployment training, and to my surprise, my son was swinging a golf club, which I was really surprised. He's big into martial arts, fighting, hunting, fishing. So I asked him what's going on with the golf thing, and he explained the golf course was right there on the base, right by his barracks. He didn't want to go out into town drinking at the bars, getting in trouble and stuff. He wanted to kind of find something good to do while he was away from home, and picked up a golf club. And some of the guys at the course, retired military guys, started working with him on his swing, and he just found it was enjoyable. It was relaxing. It was a good way to kind of spend a day on the weekend or get away from training for a while and relax his mind. So I go down there. I had played golf 20 years prior, and then when I went in the military to start raising a family, I got totally away from golf, time and money. Anyway, long story longer, started swinging the club again with my son. I wasn't sure if my back could take it, the injuries. Swung real easy, did pretty good, and when I was out there, I was just like, man, I miss this. It's peaceful, the trees, the focus. You kind of get out of your head and focus on the game, the camaraderie, just spending time with my son. Came back to California, he deployed. I picked up a used golf set in California and just kind of kept coming out to the driving range on my own, and then eventually went back on the golf course. And again, I was just like, I miss this. This is good. It's good for me. And from there, we just started finding our community partners, like right here at General Old. And right now, I'd say we have a pretty consistent 8 veterans showing up every week. So that's how it got going. We had to find consistent courses that would support us. Golf has money involved. All of my other peer sport groups, they're free, period. So this one, we had to work out some things with the VA to make sure everything was legit, with donations or how we could fund it. And then just, again, finding a home base. Once we got all that established and we started drawing the veterans, the word of mouth, already you can see, people think we're just out here swinging a golf club. You can see the camaraderie. You can hear the conversations, the laughter. We got veterans that they look forward to this every week. It's how they get out of their house. And so it's just really cool watching, even right now as I'm talking with you, I'm looking over here at 3 and 4 conversations going on that have nothing to do with golf. So that's what I'm enjoying about it.
So Lynx, as you guys probably know by now, that's what we're out here doing. It is a golf group. It is a group that gets people out of their house to come out here, be a part of one with nature, so to speak. I've been doing this for many years now. This is kind of my mental health treatment plan, so to speak. It gives me the ability to come out here and just forget about all those things that we deal with on a day-to-day basis. Whether I'm playing actual round or whether I'm on the range. It just gives me that release for a couple hours to just think about nothing, where all I'm focusing on is the sound of the golf ball and the wind blowing through the trees and hearing the birds chirping. It just really lets you not focus on things that are easy for us to focus on, whether that be why am I here and how come I can't be around crowds and how come my family is not treating me this way, why all these things that bother us on a day-to-day basis. Golf for me gave me the release to come out here and not think about any of that for several hours. So Ted and I sat and talked one day, and I really started getting into details as to how it helped me and literally saved my life in many ways. And we thought, well, if this is working so well for you and it's working for me, why don't we bring this to these other veterans and just kind of see if they would be interested in stuff like that. And we went out and talked to some of the community partners here. We got people to give us time on the range here. We started out with maybe 2 or 3 veterans, and now we're up to 10, and we're hoping to grow that group to even bigger, because a lot of these people that come here, this is the only time they get out of the house all week. And all we hear from them when we check in with them throughout the week is, I can't wait to see you guys next Tuesday, because it just gives me, again, that release. I don't think about anything but the laughing and the joking and the making fun of each other and making fun of the different services and different types of swings, just all that stuff. But it all comes down to nobody is thinking about the problems that we face on a day-to-day basis. We're thinking about the process of feeling like you're a part of something once again, and that's what this group is really centered around, and so far it's working really well.
So where I'd like to see this group go is where now that we have a really consistent home base here, we're branching out to do field trip days where we take veterans on the golf course. We got quite a few courses in the area that are willing to partner with us, either play around for free or at a really reduced cost. We have community partners that want to step up and donate to offset those costs, and we would like to just expand the program, get more veterans out, open up different chapters, because we're dealing with 2 huge counties, Riverside and San Bernardino. So maybe we have a high desert chapter, a low desert chapter, a Southwest Riverside County chapter, and the ultimate, we want to do a fundraiser golf tournament every year to help raise awareness about veteran issues, raise money for the program, and yeah, I mean that's where I'd love to see it go, man. Just things like that. So yeah.
I'm sitting in a circle of heroes, but they wouldn't like that name. They're a humble group, rich with history, and none of them seeking fame. I consider it a privilege to sit amongst such a group. They simply smile and welcome anyone who would like to join them. They come from a variety of backgrounds, yet share common bonds. They are plenty tough, but allow themselves to be vulnerable as the ink touches paper. Emotions, sometimes caged for decades, are brought to the surface as the pen speaks what the tongue has held back. Like a volcano releasing some pressure, tears stream down the warrior's face as they read. Oftentimes, the tears are followed with conversation, a slap on the back, and laughter. Yeah, I'm sitting in a circle of heroes, shoulder to shoulder, side by side. These trailblazers have no fear as they continue through their journey and write.
And I was like, What? You mean he's already a match? You've approved him? And she said, yes, he's been approved. He's your donor. Let's do this. Hi, my name is Kendra Pearson. I'm 42 years old and live in Pueblo, Colorado. When I was 8 years old, I was flown to Children's Hospital because I became very, very sick. At Children's Hospital, they diagnosed me with autoimmune hepatitis. It's a disease in which your body fights your liver. In July of 2012, when I was 32 years old, I was added to the transplant list. By September and October, I was already in and out of the hospital. I was in the hospital more than I wasn't. In October, the doctors came in and told me I had 3 months to live and that I most likely wouldn't live to be on the top of that MELD score where I would get a deceased donor. So they advised me to try to find a live donor. When I originally got sick, my husband volunteered to be my donor, but we had 2 young kids. They were 4 and 6 at the time, and I didn't want him to donate because we had such young kids. But by October, I was so sick and I was so nervous that I wasn't gonna make it that I let him test. In the meantime, my husband's test came back and he happened to be a match. So he became my donor. In February of 2014, he donated a piece of his liver to me. 5 years later, I started having symptoms again and became very sick. This time I wanted to take what I had learned from my first transplant and start working on a live donor right away. So I immediately shared it on Facebook. I had several friends and family test right away. Most of them did not end up being matching blood type, and the few that were matching were eliminated right away for health reasons.
So I was just mindlessly scrolling social media one evening, and I came across a post that a friend of mine had shared about somebody looking for a living liver donor. Now, I'd never heard of that before, and I probably would have kept scrolling, except it caught my attention that I was a blood type match. So I went ahead and clicked the link and did about a 10-15 minute online survey. And when I was done, honestly, I didn't think about it again. I kind of forgot about it. And then about a week later.
Hi, Raymond. My name is Jamie. I'm a living donor coordinator at UC Health Transplant Center in Colorado, calling to discuss your potential interest in living donation. At your convenience, please give me a call. My direct phone number is 720-848-0738.
So I became really defeated. Then February 3rd, I got a phone call from my nurse coordinator, and she told me, Kendra, we have someone here that's a match. And I was like, great. I thought she just meant he got his blood work, he was the right blood type, so they were gonna, go through that next process. And I said, okay. And she said, but he can't do it till March. And or he can only do it a certain day in March. And I was like, okay, the testing? And she said, no, he can only donate in March. And I was like, what? You mean he's already a match? You've approved him? And she said, yes, he's been approved. He's your donor. Let's do this. And I was just floored because I had no idea anybody was testing. I had no idea who it was. It was just somebody I'd never met. They wouldn't tell me anything. I was just completely caught off guard. So that day, I'll never forget it, February 3rd, 2022, I found out that I was scheduled for surgery in March from a random stranger I didn't know.
And so most veterans, most people that join the military do so because they have a desire to serve. And that desire doesn't go away when you get out of the military. A lot of veterans look for new ways in which they could serve their community. And for me, that's exactly what this represented.
So when I did have my transplant, I had it on March 9th, 2022. I was out of the hospital in 6 days. 6 days. I was walking on the floor the second day. I walked every day I could. I did everything I could. Ray has not only given me a gift of life, he's given my kids a gift, my husband a gift, my family a gift. We all will never be able to thank him for what he has done.
The surgery, from beginning to end, it was about 6 hours long. Recovery process is going to be different for each and every person. For me, I spent 5 days in the hospital recovering, and then I was discharged. And after discharge, it took probably about another 10 to 15 days before there was no longer constant pain or discomfort. Now, of course, you get appropriate meds and you're given all the tools to help reduce that pain and to make it manageable.
But on top of that, he's made me a better person. I always now think of what he did for me, and I try to do more for others. Ray had 2 young children and a pregnant wife. He lives in California. He came down here on his own with these responsibilities and donated to me.
I'm not saying that this is for everybody. You really need to be dedicated to doing this. You have to have a desire to do it. You need family support. I was fortunate to have a very supportive wife that was all for me going through the process and, held down the fort at home while I was 1,000 miles away doing this process. So, that support has to be there. It's not for everybody. I will say that I am proud of a lot of my accomplishments from my time in the military, but I don't think that any of them I would hold any higher than the feeling of accomplishment that I got from being a living liver donor.